America is home to 33 million small businesses, the beating heart of communities across the country.
And proof that the American dream is still alive.
This is a show about those dreamers and doers and the communities they serve.
Their real life stories.
Their struggles and successes.
Their grit, determination, and passion.
And the people who fight
to keep their American dream alive.
I'm Alfredo Ortiz.
I'm Elaine Parker.
And it's time for another episode of Main Street Matters,
America's small business megaphone.
Hi, and welcome to another episode of Main Street Matters. I'm Elaine Parker, the president of the Job Creators Network Foundation.
And I'm Alfredo Ortiz, CEO of Job Creators Network.
Please subscribe to the show at salempodcastnetwork.com or wherever you get your podcast from. Today, we're joined by former Congresswoman from New York, Ann Marie Buerkle. In addition to serving in Congress, Ann Marie is a former nurse and served as a commissioner at the U.S. Consumer Product Safety Commission. Ann Marie is here to discuss the Biden administration's idea to cut funding to 33 million Americans who use Medicare Advantage, mostly seniors. Analysts say this could expose seniors to higher out-of-pocket costs per month while they are on fixed incomes and dealing with historic inflation. Congresswoman, thank you so much for joining us on Main Street Matters, America's small business megaphone.
I'm so glad to be here. Thanks for having me.
Well, tell us a little bit about your background. You're a nurse, you got into politics, you just have a very varying background. We'd love to hear a little bit about you.
Well, thank you very much. And as my mother would say, jack of all trades, master of none. I did go to nursing school after high school and practiced nursing for several years, and then got married, I have 6 children. And it was in 2010, I was working for a large teaching hospital in upstate New York and realized that the Affordable Care Act and what they were proposing in that legislation was going to hurt the hospital that I was working at. And so I can remember sitting at my desk thinking, it's really important that the voters here in this district have an alternative. There was a Democratic incumbent. And so I resigned from that job and then ran for Congress in 2010. And if you think about that election was primarily about health care and the concern that the American people had about having access to health care, quality health care. And it's never stopped. It's continued on from 2010, the concerns with health care. So I was elected. It was one of the biggest upsets during that 2010 election, and served in the House, and it was just really the greatest honor of a lifetime. Especially, I was a chairwoman of the subcommittee on health for veterans, which was wonderful. And after I lost my election, President Obama appointed me to be a commissioner at the U.S. Consumer Product Safety Commission, and then President Trump appointed me to be the chairman there. So I was there for 7 years. That's an independent regulatory agency, which is a little bit different than some of the others that are more political. So you have a term rather than changing with the administrations. So I did that, and now I'm out in private practice.
Oh, interesting. Okay. And yes, you're right. That 2010 election was very much about healthcare. And I can remember learning about how awful the Obamacare bill was going to be. And of course, we've continued to see our healthcare choices decrease and our healthcare costs increase over the last 10, 12 years that we've been dealing with this law. But you have talked about some cuts to Medicare Advantage that I think a lot of Americans are not really aware of. Can you talk a little bit about the Biden administration's plans there?
I'm happy to, and you're so right. I don't think many Americans, in particular seniors, are aware of these cuts and how it will affect them and their access to health care. So, and this is now the second time President Biden has cut Medicare Advantage. And there's a difference between Medicare Advantage and traditional Medicare. Medicare Advantage is a public-private partnership, and so the government, via Medicare, pays a private insurer to essentially manage that care for a senior, and that's Medicare Advantage. it can include, services such as hearing tests, eye, vision, dental, very important services for seniors. Oftentimes the out-of-pocket is less than in traditional Medicare. And so that's the side of Medicare that he's cut, Medicare Advantage, for roughly, as you stated, 33 million Americans. This has been cut. And I think what's problematic is the cuts don't go into effect until after January of 2025. And so I don't think the seniors and people who are on Medicare Advantage will even notice this until after the election, which I think is disingenuous because fundamentally, seniors love Medicare Advantage. The people who are on it, 90% of them, 33 million Americans, 90% of them love their plan because you can have a zero out-of-pocket payment, which is so important for seniors on a fixed income.
Yeah, well, I was actually wondering in terms of, why would he be doing that in particular? Because it's really hurting, I think, the most vulnerable, with our seniors. And is it just because he thinks he can get away with it? I mean, I'm shaking my head here thinking, why are you doing that? I know several, my mom, and others and seniors were on Medicare Advantage. They loved their Medicare Advantage and really provided some really incredible services that were desperately needed for them. Why is he doing this?
Well, I hate to sound conspiratorial, but it really isn't. It really isn't a conspiracy. It's well known that the plan among the progressives, if you look at what Bernie Sanders says and does, and he's chairman of the Health Committee in the Senate, so they dictate policy for health care in this country. They all want to get to a single-payer health care plan, a Medicare for all plan. And so this takes away from the private sector involvement, and it allows more money to go into traditional Medicare. And that's everything that's done in this administration is to that end goal, really, of getting to a single-payer healthcare system, which is very unfortunate because when you have the private sector involved, you have more oversight, you have coordination of care. Medicare Advantage, among all of the wonderful benefits, it's also, you've got an insurance company looking to see, whether or not that patient needs the care that the provider is trying to get charges for. But not only that, it makes sure that there's no fraud. I mean, Medicare, traditional Medicare, if you look on the DOJ's website, just for 2023, there's over $3 billion in fraud. Wow. So Medicare Advantage is it's that private, really the private participation that makes it more efficient and lowers the cost of it. So Medicare Advantage costs 83 cents on the dollar as opposed to traditional Medicare. So that's not insignificant for the taxpayers.
Well, of course, then we have to get rid of a system that's more efficient and more effective. I mean, why would we want to have that in the government system? I mean, we got to get rid of it. I mean, it's just absolutely crazy from my perspective. But that makes a lot of sense, right? Trying to get rid of that. I know Elaine and the foundation, we worked a lot with Secretary Tom Price on a alternative to Medicare for All called Healthcare for You. Bernie Sanders had his bumper sticker, and we created our own bumper sticker. Elaine, I don't know if you want to get into that, but I know it was a great alternative to what Bernie Sanders was trying to promote. But boy, they really are trying to get rid of that private industry thing. I'm kind of surprised at the lobbyists. I mean, I think United Healthcare is probably one of the largest Medicare Advantage providers, if I remember correctly. Why they're not lobbying harder for this and getting the word out to the 33 million seniors that are on Medicare Advantage?
Well, that's a great point. And to the podcast today that we're doing and we're talking about it, it's so important that we do get this word out for the seniors so that they do have knowledge of this is what's being done and so that they can get to their representatives, their member of Congress or their state senator and say, we don't want Medicare Advantage cut. We really like this program. Let the private sector stay involved in healthcare and our healthcare decisions. There was a poll done late last year, I think it was, and 39% of Americans said they would cross party lines if that that person running for office could guarantee them lower health care costs as well as access to health care. So health care is very important, as it was in 2010, and it always is. So important for everyone, right? You've either got a parent or as you mentioned, or yourself, and healthcare is very important.
Yeah. Well, we just yesterday, I guess, I was up in D.C. We just signed a partnership agreement with AMAC. If you're familiar with AMAC, they have 3 million, I think, members. So I will make sure. I'm sure they're actively involved in it. And if not, they will be. I will make sure to touch base with their CEO and make sure this is something that we actively start getting the word out on, because I mean this is really enormous. The impact. They seem to count on, this administration seems to count on things like that people just hopefully will not notice until it's too late.
Yeah, unfortunately, and it's very deceptive to seniors. As I say, they love this program, and they don't want it to be taken away.
And with the program, you think, I mean, are they trying to basically dissolve Medicare Advantage, or just keep funding less dollars towards it? I mean, I guess I'm trying to understand the actual impact it's going to have to our seniors.
So, as Elaine mentioned in the beginning, the first impact it will have it will increase their out-of-pocket costs. And so this time around, for this year, the costs will probably go up. Their out-of-pocket costs will go up about $400 a year. Now you say, well, that's not all that much, but for someone on a fixed income who's dealing with the inflation that this nation is going through right now, the GDP number came out this morning, inflation went up and growth went down. That's the worst combination. I mean, the cost of food, the cost of energy, the cost of the gasoline for your car. So if you're dealing with all of that, and then on top of that, you've got an increased out-of-pocket payment for your Medicare Advantage, that's not insignificant for a senior on a fixed income. And so it's so important that they know that this is going on, and they raise it with their member of Congress and say, protect this Medicare Advantage because we really like the program.
I don't think it's a conspiracy theory what you said about the goal was always to move everybody into one sort of healthcare pod, the single payer. Obamacare has been a threat to Medicare from the beginning, and it was very clear from the beginning. But sometimes it seems like Americans, they don't want to know the sausage making of healthcare. It's so complicated. And Alfredo alluded to we created a framework for healthcare reform. We're not repeal and replace people. We're repair and restore. And it's about, making some changes on the outer edges to Obamacare that would allow states to take back the power or the authority to create vibrant economies, healthcare economies, where we could have more healthcare companies come in and create policies that are, from catastrophic to Cadillac plans, depending on your healthcare needs. Because right now it's a one size fits all, that everybody has to comply with sort of that standard list of things. If you're a 60-year-old man, you're paying for pregnancy, maternity benefits. And so if we can create more choice and competition, it will naturally bring down the healthcare costs. And then there's the new model. I'm curious. I'm actually getting to a question. The new model is the direct primary care model, which I subscribe to. And those are physicians that have opted out of healthcare, and they've created kind of like a gym membership. It's a membership plan. It's not the expensive plans that used to come out when Obamacare first passed, but it's like a gym plan, $50, $60 a month, covers all your primary care needs. I have a direct primary care doctor. I love it. I love that I can message her anytime I need to. I can get in to see her. I don't have to wait 6 weeks for an appointment. It's just a fantastic plan. And I'm wondering what your thoughts are on direct primary care, and are you seeing it take hold across the country if you're aware of this type of model?
I am aware of this type of model, but I really can't speak to it. I'm not sure how well it's taken. But to your point, and a very important point, is this is, and we'll talk politics for a minute, this is a wonderful opportunity for the Republican Party. Now, first of all, you said of something very important, and that is the ship has sailed on the Affordable Care Act. We can't repeal and replace. Those days are gone, so don't waste your time doing it. We, with a 65-member majority in 2010, couldn't do it, right? So it's not going to get done in this environment. But there are things, to your point, that really can be done to make healthcare more personal and get away from that one-size-fits-all, make healthcare more accessible and less expensive. And Republicans should, especially like now with this Medicare Advantage, seniors are an important voting bloc for both parties, but they should look at all of these healthcare issues and say, is this going to empower the private sector? Because if it is, then we want to support it, because we want to share that power and that decision-making of healthcare with the private sector and not just have government have all of that. And I do want to make one other comment, and that is, you mentioned earlier, Alfredo, about cuts being made and why. One of the other cuts they made was to physician reimbursements. And so when they pay less to the doctors for their services, you see more consolidation. You see more of these, you see the healthcare systems. When I trained in a neighborhood hospital, 450 beds. Now it's part of a large Trinity conglomerate. There's 88 hospitals in that system. That only raises the cost of healthcare as well and makes it less personal. And so, to your point, Republicans have an opportunity, and they should really be paying attention to this, because I know there's a lot of noise out there. There's so much going on today in the country. However, this is an issue that affects every American, and they may not articulate it. They may not say it's my very most important topic, although in some polls it shows it is. But they really should seize this issue and pay attention to what's important to the American people.
It amazes me, Ann Marie, that Republicans have not been able to actually stick the landing, so to speak, on healthcare, because I think we have better principles, better ideas when it comes to this. The personalized healthcare, the doctor-patient relationship. Government should not be involved, in those discussions. I mean, I just don't understand why we fumble the conversation on healthcare so badly. I respect so much what Trump did for this country during his tenure. I will tell you, though, during the debates, that was probably the one area he just kept fumbling on was healthcare. What do you think Republicans should be saying, doing now? They always seem to be tripping up on, what's that called? The pre-existing conditions. If you were to advise President Trump right now on what he should say about healthcare for Republicans in a debate situation, what would you recommend to him?
Well, and I do want to just say, because Elaine mentioned it earlier, healthcare has become so incredibly complicated. You can't even, if you go to the emergency room and get your arm fixed because you broke it, they can't even tell you what the actual charges are. It's all negotiated based on the Medicare rate. It is so complex, and it's different for each payer. Each payer pays a different rate. So, and they build in capital improvements for the hospital into that fee. So it's insanely complicated. But you can take issues, and I would say this to President Trump, take issues like this one, that the American people know, the seniors, 33 million Americans know, I like my Medicare Advantage program. I don't want it to be diminished. I don't want it to go away. And I want to have those choices that it allows me. And so get to the issues that people can identify with. A lot of them are way complex for most people, for everyone, even in politics. The politicians don't even understand it, which is why I think they fumble so much on this issue. But pick the ones that people can relate to and that you can understand as a politician. For instance, the pre-existing condition. And that has been changed. That has been memorialized with the Affordable Care Act. You cannot deny pre-existing conditions, which is a good thing. That's one aspect of the Affordable Care Act that the American people loved, and so you keep it. we had a large, small medical device company in our district, and so we worked to get, there was a significant tax on them in the Affordable Care Act, and we worked to get that lowered as part of the reforms of the Affordable Care Act. And I think Republicans need to be realistic. Pick 3 or 4 aspects of healthcare that can be reformed, that you can stand and say, I'm not going to cut your Medicare or your Medicare Advantage as this administration has done. I'm going to keep it intact. And Donald Trump has said that. I won't cut Medicare. I won't cut Social Security. That's an important message for the seniors, because oftentimes we hear the opposite. The Republicans are going to cut Medicare. They're going to cut Medicare. And so the Republicans need to be steadfast and have a really good messaging on this point, because, in fact, it's this party, the Democratic Party, and this president who are making the cuts.
Yeah, I mean, that's so true. You mentioned Social Security. I mean, the reality is we are going to have to make adjustments on Social Security. But it seems as though the Republicans can't articulate that one either. That if, let's say, I did an analysis and kind of figure out what a phase out would look like. If you're like 40 and up, nothing's going to change for you, right? You're talking if you're born today and 40 or less and born today kind of thing. Those are the people that are going to slowly see changes, over the years, whether it's, a quarter year increase on the retirement age or contribution amounts, right? Or just a complete phase out of Social Security, something completely different, maybe more market driven. But they just can't articulate these points well. But we do know that something has to happen to Social Security as well. And it is ironic that the Democrats keep slamming the Republicans for getting rid of your Medicare when that's exactly what they're going to do.
Mm-hmm. That's exactly right. A lot of it is projection. And unfortunately, Republicans, they're focused on a lot of issues, a lot of important issues, whether it's the border or corruption in government. But this is something, again, that's very personal to the American people, and you cannot disregard it. You've got to figure out what the messaging is, and you've got to say it over and over and over again. When you talk to senior groups, this is something that's already happened twice in this administration, and God only knows what will happen in a second administration when they don't have to worry about a re-election again. So but you're so right that these issues are complicated, but politicians have got to learn to articulate them, because otherwise they're going to lose elections. And I say it's politically a smart thing for the Republicans to do, but it's also the right thing to do. This nation is based on free market principles. And so to just acquiesce our health care to the government just is incredibly wrong. And the right thing to do is to keep that public-private partnership with Medicare Advantage.
Yeah. Well, and when you have 33 million seniors participating in that, and we know that elections are not won or lost by millions, it's actually won or lost by tens of thousands because of the Electoral College, right? You can literally probably flip an election with, handful, relatively speaking, to those that are participating in the Medicare Advantage. So you would think that they'd be more actively pitching this and making it a bigger issue for the November election. So,
and interestingly enough, the swing states, Michigan, Wisconsin, Arizona, the swing states, in all 6 of them, I believe there are, over 50% of the Medicare eligible people are on Medicare Advantage. So it's something that will resonate with them, and it's a message they will understand. And so again, it's so important that Republicans get out there and talk about
absolutely. It. Elaine?
Congresswoman, the Inflation Reduction Act, actually a very poorly named bill, but the Inflation Reduction Act that was passed early in Joe Biden's administration contained price controls for drugs. Talk to us a little bit about that and how the pharmacy benefit managers play into that.
So again, anytime you can get the government out of your healthcare decisions and negotiating the price of drugs, the better the American people will be, and the better that healthcare will be. Because, of course, they only know a certain formula in the government, and it's always higher prices and lower services. But the pharmacy benefit managers, and there has been an all-out attack on them in this past Congress, and it's come from both sides of the aisle, because I think it really reflects, to Alfredo's point, a lack of understanding and a lack of ability to articulate the issue. But these PBMs they're a program that's run again by the private sector, and they look at drugs, they look at prescription drugs. Is there a cheaper one that's available? Is there one that will work more effectively? And they essentially, behind the scenes, manage prescription drugs and keep the cost of drugs down. And also, they increase compliance. If patients take their drugs, the outcomes are better and you can reduce the number of hospitalizations. And so PBMs are really a good thing. They're the only thing that stands between big pharma and cost for the insurers and for the consumer. And they negotiate those prices down with pharma. So the way the PBM works is PBM works for an insurance program, and they negotiate with big pharma to get the cost of drugs for that plan down. And so because they have leverage, they have millions of people in the plan, they have the leverage to get the cost of drugs down. So big pharma hates PBMs. It's their nemesis because it forces them to lower drugs and the cost of drugs to healthcare plans. So that's why there's been such an attack on PBMs. But another point, Elaine, about the whole drug thing is the FDA needs to be modernized. They need to, pharma plays some tricks. So if the patent and the license is about to expire, sometimes they'll change the color of the drug. It's essentially the same, but they'll change the color or some feature about it so they can extend that patent. When the patent comes off of that drug, then you get into generics, which always keeps the cost of drugs down. So FDA needs to modernize. They need to look at some of these issues, and they need to make sure that they're protecting the integrity of and the safety of drugs and pharma, but then and also providing. We all know that pharma does a lot of research and comes up with new drugs and solutions, and protect that. But at the same time, make sure what they're doing helps to keep the cost of drugs down. And so the FDA really does need an overhaul and some modernization.
You know, I've done some research and done some writing on PBMs, and the PBMs. I know there's a role for them, but what I've read and we've written about is the rebates that don't make it to the patients from pharma. So, you know, can you talk to that, why the PBMs, the rebates that would actually help lower some of the drug costs never make it to the patients? They stay with the PBMs, and then there's the control they have over the drug supply and what drugs actually get prescribed, and a little, I guess you could sort of call it a monopoly. I mean, there's only 3 major PBMs out there. I think that could have some impact as well. Can you speak to that?
I can, and I do think that on the rebate issue, that could be fixed legislatively, but that's the system that's in place. It could be fixed if that's the true opposition to PBMs. But I think it's more that pharma just doesn't like them because they force the cost of healthcare to go down, the cost of drugs to go down, which because this party is negotiating with them to get the cost of drugs down for that plan. But I will say, I think there's a lot of misinformation out there about PBMs and the good that they do and the coordination of care that they provide that, as I mentioned earlier, same as Medicare Advantage, they look at the whole situation in totality to see, has this patient filled their prescription? Are they taking their drug? Are they trying to refill it too soon or not soon enough? And those kinds of, that kind of oversight just doesn't occur otherwise.
Yeah. I think that there definitely needs to be some legislative action on the PBM side. And I think that could help in some ways to further additional savings. I'm not so sure that either side is interested in pursuing those types of solutions, though. So we'll have to come back to that one. But where can people go, our listeners go, to find out more about what you're doing? Do you have a website or anything that you're working on?
I don't have a website. I have an X handle, which I will send to you all so you have that. But yes, I do a lot of writing and op-eds, and we can send those to you as well. Just because healthcare is important and because so many Americans care about it. And there's just an awful lot to say about it, and to try to Alfredo's earlier point, get it down to terms where the American people understand what's going on, and to really, and to encourage them on whatever issue it is, to engage with your member of Congress. These are your representatives. They should be your voice. And unless they hear from you, they don't know what you're thinking. So not to be afraid to engage with them, to let them know, protect my Medicare Advantage. And so we encourage people to do that because it's so important that they hear from you.
Well, I want to thank you so much for taking the time to join us on Main Street Matters, America's small business megaphone. Thank you all for taking the time to listen to us today as well. Main Street Matters is part of the Salem Podcast Network. New episodes debut every Wednesday and Friday, and we'll be back real soon with another new episode.